I want to come on here and address something that I have noticed recently with a lot of my new patients that has been a huge deterrent to accessing treatment for an eating disorder. Now, if you know anything about eating disorders, you know that they are one of the most lethal mental illnesses. They are very dangerous, and time is of the essence for a treatment of an eating disorder because they can develop very rapidly, very quickly, and that matters when it comes to treatment outcomes. The earlier you get care, the better treatment outcomes. So if, let's say, for example, I'm struggling with my relationship with food, maybe I'm binging and I'm purging or doing self-induced vomiting, I'm gonna want access to care. What's the first thing that everyone does? They Google. What's the first thing that pops up on Google? Criteria for an eating disorder. Where did they get the criteria? The DSM-5. Now, according to the DSM-5, bulimia nervosa, for example, under criteria C, states that binge eating and inappropriate compensatory behaviors both occur, on average, at least once a week for 3 months. Psychologists do not only use the DSM-5 to diagnose. We use many other assessments, many other instruments. We do a deep dive intake clinical interview to understand the very complex nuances of an eating disorder. So if you have Googled this and you feel like, oh, I guess my eating isn't bad enough or isn't severe enough or doesn't meet criteria according to Google, according to the DSM-5, that doesn't matter. That doesn't matter. You deserve access to care. You deserve access to treatment, no matter if you're doing binging and purging once a week or once a month. Both of those people deserve treatment and deserve therapy. And so I am begging you, go get help. You deserve therapy. You deserve treatment. And this is something that I have a problem with, is that sometimes Western medicine can actually act as a gatekeeper. It can act as a deterrent and a barrier for people to accessing care because they put these arbitrary dates and arbitrary numbers. But I'm here to tell you that that is not the only thing we use. And even if you don't meet formal criteria, you still deserve support around your relationship with food and support around your relationship with eating and yourself and your health and your body. So please, if this isn't your sign, this is your sign. I'm telling you, this is your sign.